all. Just getting some information in here for everybody.
Hello.
Hello.
How are you?
I'm good. How are you?
Good. I'm excited to get today's conversation going.
Me too.
So you just have to pin the comment, Jess.
Oh.
You can just hold it down and it should come up as pinned comment. Hello, everybody. Thanks for joining us.
Like I should just be able to hold down on my comment?
Yes.
Well, I'm holding down on it, but nothing is coming up.
Try tapping it.
Ah, yep. Okay.
Hi, Lisa.
Hi, everyone.
Okay. Hi, everybody. My name is Sol. I am one of the social media influencers for the community health team. My pronouns are she, her, hers. And I'm excited to start this conversation with you guys. As you know, over the past few months, Whitman-Walker's community health department has expanded its outreach efforts to the social media platform. We've been covering various topics about HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focuses on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So thank y'all for joining us today. Our conversation is going to be about how to effectively use a mask and gloves to help prevent the spread of COVID. And to help me lead the conversation, we have Jess Harnish, who's the nurse manager for occupational health at Whitman-Walker. And let's get started. Don't forget to participate in the comments. This space is for us. Thank you for joining us, Jess. Can you tell us a little bit about you?
Hey, yeah. So my name is Jessica Harnish. Everybody just calls me Jess. My pronouns are she, her, hers. I'm the nurse manager of occupational health at Whitman-Walker. I work a lot with our employees. Work a lot with our employees and with PPE, personal protective equipment, and I love hand hygiene, probably a little too much. Yeah, that's me.
Cool. Well, I'm excited to have you here, and I'm happy that you can share some information with people.
Yeah.
So we see a lot of people wearing masks and some people not wearing masks. Why should folks wear masks, and how often should they wear them?
Yeah, so good questions. Wearing a mask or face covering in public and in high traffic areas, like grocery stores and pharmacies, can really help prevent new cases of COVID-19. Masks and face coverings help prevent the person from wearing the mask from spreading respiratory droplets. So it's really helping other people, and then other people wearing masks are helping you. The droplets are the main ways that COVID-19 spreads, so effective mask use is key in fighting COVID-19. It's important to wear masks, especially in spaces that you cannot socially or physically distance yourself.
So we know that due to police brutality and against Black and brown people, it's even more important now to consistently wear a mask and handle it correctly because people are out and protesting. How can they protect themselves at protests and mass gatherings with COVID still being prevalent?
Yeah, so I'm glad we're talking about this. During protests and in spaces, especially where social distancing is difficult, it's even more important to consistently wear a mask and to handle it, put it on, and take it off correctly. This means practicing good hand hygiene before and after touching your mask, and making sure that it snugly covers your nose, mouth, and chin at all times. It's also important to hold people around you accountable for wearing their masks correctly, because I protect you when I'm wearing a mask, and you protect me when you're wearing a mask.
Well, can you share some tips with us on how to effectively use a mask, how to wear it?
Before we go there, sorry, I moved on too fast. Another tip, when you're in spaces and it's difficult to distance yourself, is that when you need a snack or water, is to try to leave that space, that crowded space, before eating that snack or taking a drink. Consider using a beverage container with a straw in order to make it easier just to lift your mask and use the straw. And then you want to clean your hands before and after removing your mask, and in between touching and eating your food or drinking your beverage. It's ideal to take a drink or grab a bite to eat before you put on your mask. So I'll take a drink myself. Okay, so you had asked about tips on effectively wearing a mask.
Yeah.
So we're going to go over a few different types of masks, from disposable to cloth, and how to effectively wear and handle them. But the first rule of all mask use is good hand hygiene. You want to wash your hands with soap and water for 20 seconds. That 20 seconds is before you're rinsing your hands off. 20 seconds does not include drying your hands. So after you wash your hands, dry your hands well. If soap and water is not available, you can use an alcohol-based hand sanitizer that is at least 60% alcohol. Do that also for 20 seconds. Hand sanitizer is equally, if not more effective at cleaning your hands than using soap and water. However, if your hands are visibly soiled, if you have something on your hands, you want to go ahead and use soap and water at that time. Otherwise, you're just rubbing. It would be like if you had ketchup on your hands and you just decided to use hand sanitizer and you just rub the ketchup into your hands. It's weird. So you want to wash your hands at times like that. Other good times to wash your hands with soap and water are before and after cooking. Definitely before you use a restroom or, before and after really using a restroom. Yeah. So when using a hand sanitizer, you want to use it until your hands are dry. This is more effective at cleaning your hands than waving your hands dry. So I'm going to go ahead and show you. So I have hand sanitizer here with me. The ones that have the pump are usually meant to pump the correct amount, but if you don't have a pump and you have one that you pour from, you want to use, yeah, perfect. So you want to use that for, put about a quarter size or so, and use that for 20 seconds. I'm going to put a full pump in my hand, in the palm of my hand, try to show you how much I have there. And I'm going to start rubbing together, and then I'm going to use my fingernails, just kind of scratch the palm of my opposite hand to get some hand sanitizer under my fingernails. And you want to do the backs of your hands, go around your thumb, go in between every finger. And you can see my hands are still wet right now. And I don't want to just dry them by shaking my hands. You want to keep going until your hands are totally dry, not sticky at all. You can also clean under your nails using soap and water. You could use a nail file or a nail brush. Those are also good. So now that we've used our hand sanitizer, we can think about using a face mask. So I'm going to start off with a disposable face mask. First, you want to take a look at it, make sure there's no holes or tears. Mine has a cat hair on it. The outside of the mask is usually colored, so the outside of mine is yellow and the inside of it is white. Find the top side of the mask. So the disposable masks usually have a metal nose piece, and so that's why I flip mine over so that's up top for my nose. You want to mostly handle the mask by the elastic ear loops. So I kind of put my chin in first and then my nose, and then adjust the nose piece. So I'll go ahead and show you that. I won't be talking while I'm wearing the mask. So then on the sides, you can see I don't really have any gaps. And so I also showed you want to put on your glasses after you put on the mask if you do wear glasses. Yeah, so I made sure that there were no gaps. Air shouldn't easily flow through the top or the bottom or the sides. I know I'm touching my face a lot right now, but you want to avoid touching your face when you are wearing a mask. That's why we use the hand hygiene before and after. So for removing the mask, you do want to clean your hands again for the 20 seconds. Keep the mask away from yourself and surfaces when you're removing it. So, you know, assume that there are germs on the outside of the mask. Considering that it's disposable, you want to discard it, ideally in a garbage bin with a closed lid. And then wash your hands again after discarding the mask. All of these steps together are what help you to wear a mask effectively. If you do have to wear a disposable mask for a longer period of time, like a full day, or if you need to reuse a mask, still practice good hand hygiene. So I know I'm like a broken record on that one, but it's so important. Remove the mask by the elastic ear loops and place the mask front or colored or dirty side down onto a clean surface. Then again, wash your hands. When you're ready to put the mask back on your face, practice good hand hygiene. Again, pick the mask up from the ear loops and place it back on your face. Not touching the inside or the outside of the mask, just handling it by the ear loops. And then you want to wipe the surface where the mask was sitting with a disinfectant wipe. And again, practice good hand hygiene. And again, if you're wearing goggles, glasses, or a shield, which would you recommend? Because the eyes are one of the ways that COVID-19 can get into your system. You put that on after putting on your mask.
That was super informative. What do you say to folks who are using the same disposable mask for longer periods of time or for more than one day?
Yeah, so I would actually suggest that they go ahead and get a cloth mask that they can wash in between uses. Some businesses have started producing cloth masks. Yeah, I have a couple here. So they come in different styles. This one's a little fancy with some ribbons going on. This is just a safer way to prevent people from getting COVID-19 if you're needing to use the mask for a longer period or multiple times.
Can you share some more information about effective ways to use other types of masks, like cloth masks?
Yeah. So before I go into cloth masks, I do want to mention that there are masks that have a plastic shield attached. So it would be the same kind of thing as this, except it would have a clear plastic shield that goes over your eyes. With those, sorry, I don't have one here with me right now. With those, I recommend folding that kind of mask completely in half, including creasing the clear shield part, because it'll help form it like around your face instead of it being straight when our faces aren't straight. So for cloth masks, if they have ear loops, you still want to hold them by the ear loops. This one has a top and a bottom, so you can kind of see that it's molded to go over my nose. And same thing, so hand sanitizer. Sorry guys, I'm going to take that 20 seconds. So hand sanitizer again. And again, you do this before and after removing the mask. I'm not going to do it after just for the sake of time. But I am going until my hands are totally dry. All right, so picking my mask up by the ear loops, I'm going to go ahead and put the mask on. And then you see that I took it off by the same ear loops. If you have a cloth mask, so I'll get my fancy mask out, you want to tie the strings at the top of your head first and tie that fairly securely. That's really what's keeping the mask in place. And then tie the second set of strings around your neck a little looser than you do at the top of your head. So I'll just real quickly show you. Well, the ribbon strings are getting the best of me right now. But tie at the top of your head first, pretty securely, and then at your neck. So let's see, what am I missing? So in terms of the hand hygiene, you can use lotion either after either after using hand sanitizer or after washing your hands with soap and water. I recommend ones without perfumes just because they're less irritating, at least to my hands. Yeah, it'll help prevent your hands from drying out and helps prevent what's referred to as micro tears, so little tears in your skin that when you use hand sanitizer, you can feel them kind of burning a little bit. Helps prevent that. If you always want to make sure to clean the backs of your hands. Some people say to do your wrists. I wasn't really, not something that I've ever really been taught to do, but some people do like to do the wrists, and that helps get the back of your hands also. So when you're wearing a mask and it fits well, it is good to get a mask that fits well. I probably have about 10 cloth face masks that I've either made or that have been sent to me by friends, and out of those, to be honest, I wear 3 of them. They fit my face the best. The ones that are kind of like the accordion fold, those don't work that well on me. They move around and I'm always having to touch my face. So you want to wear a mask that fits you well enough that you avoid touching your face. Avoid touching your face as much as possible. Touching your face every time just is more of an opportunity for germs to spread. Wash your cloth mask after use, and don't share it with others unless the mask has been washed very well. So when you do wash your mask, use laundry detergent, and then it's not that important whether you use cold water or warm water. The soap is doing the majority of the work for COVID-19. And then I suggest drying on low or even hanging the mask to dry, and this helps keep the mask in good condition.
So now that you've shared the do's of mask use, can you tell us what not to do?
Yeah, so don't ever wear a mask that is ripped or that is damp. Those won't protect you in the same way that a mask in good condition would protect you. Don't wear the mask over only your mouth or only your nose. You need to have both your nose and mouth protected. So that's a no. That we see all the time is really a no. You know, if you have germs on the outside of the mask, and by doing this, you're really just spreading germs to the rest of your face. And of course, it's not protecting other people the way that it needs to. If you sneeze, you're sneezing, get on, somebody else's face when this isn't over your nose and your mouth. Seen a few people wear them on their forehead. It's kind of a good look, but it's not helpful. Seen people on occasion wear it over their ear, just kind of dangling. That's not good. Let's see. Don't remove the mask to talk to somebody. I know that we do, kind of watching lips is part of how we converse with each other. But for this, we just want to maybe increase the volume of your voice so that people can hear you better. But don't take the mask off or lift it up to try to talk to somebody. So I actually suggest, say you're out running errands, I suggest continuing to keep the mask on even while you're in the car, so that you have less times that you're touching your face. If you are still going, like you've already been to the grocery store, you're going to the drugstore next, just keep the mask on. And then I'd even say once you're done with your chores, if you have hand sanitizer you can keep with you, use that before you take your mask off. If you don't, I would actually suggest waiting until you get home and then washing your hands with soap and water and then taking the mask off and then washing again with soap and water. If your mask is disposable, dispose of it after use. And don't leave your used mask within the reach of others. Another thing to mention is children under 2 years of age should not wear a mask, and anybody who has trouble breathing, whether they're old or young, should not wear a mask. A mask increases the work of breathing, just makes it harder to breathe. For people who don't work in the medical field, it's important not to wear N95 masks. We really recommend that those are saved for people who work in the medical field. If you do see somebody wearing an N95 mask when you're out and about, I suggest giving them the benefit of the doubt, and maybe they had those N95 masks before any of the COVID-19 ever started, because they are available at home improvement stores for people that are working with paint or doing other home improvement projects.
Yeah, I know that's where I got mine from.
Yeah.
When I had a do-it-yourself project, I had some left over.
Yep.
But that was really helpful. Can we talk a little bit more about glove use? I know some people have been wearing it as a COVID prevention method.
Yeah. So using gloves correctly can help prevent new cases of COVID-19, but it's important to note that wearing gloves while out in public is actually not an effective way to prevent COVID-19. Research has shown us that we are less likely to we're not, COVID-19 getting on your skin is not the problem. It's if you touch your face. So if you're wearing gloves and you're touching other items and then you touch your face, it was a moot point to wear the gloves at all in the first place. Practicing good hand hygiene with soap and water or hand sanitizer offers more protection from COVID-19 than wearing gloves. Hand sanitizer is actually equally, if not more effective at cleaning your hands than soap and water. But remember, both should be used for 20 seconds. I see a lot of people put hand sanitizer on and try to rub it for 5 seconds, and that's nice, but you really need to do it for 20 seconds. If your hands are dry after 5 seconds, then you didn't have enough hand sanitizer on your hands and you need to use more. Yeah, so keep rubbing. Don't wave your hands in the air to try to dry your hand sanitizer. While it might work at drying the hand sanitizer, it's not helping your hands get cleaner. So for glove use, so I'm going to use hand sanitizer now. I know I've done this a few times already, but that's just what you do before you put on gloves. So again, backs of your hands, around your thumbs, in between your fingers. You all see my Christmas tree up at the top there? Yep. That happened. I have nowhere to put it away, so. So rub your hands together until they'll get kind of sticky towards the end. And if you just keep going a little bit, that stickiness will go away and they'll dry. All right, so I have gloves here. There's not really especially much to say about putting the gloves on. There are ones that are made for right and left hands, but those are usually in the operating room, not ones that you see at the drugstores. But for, well, sorry, I was just thinking for a second if I wanted to talk about anything while they're on, but I'm going to go ahead and show you the best way to take the gloves off. I'm going to use what's called a clean to clean and dirty to dirty method. We're going to assume that the outside of my gloves are dirty. They have COVID-19 germs on them, and inside the gloves, my hands are still clean. So what I'm going to do is take my index finger and my thumb, and touch only the outside of the opposite glove. And I'm going to start turning that glove inside out. So it goes over my hand, and then see how I've turned it inside out. And then I'm going to ball it up in that opposite hand. Now I've got my left hand, which is clean because it was inside of the glove, and my wrist on the other hand is clean. So I'm going to take my index finger and go underneath of the glove, not touching the outside of the glove, and again turn it inside out. And what this does is give you the inside of the glove, which is cleaner than the outside of the gloves, and then you can dispose of it directly into the garbage can, hopefully with a lid. Don't reuse gloves. That's a no. Don't use hand sanitizer on top of gloves. That's a no. And then, sorry guys, more hand sanitizer. So yeah, don't be too surprised if your hands get a little dried out. Use some lotion. When using gloves, remember that you can still touch surfaces that have COVID-19 on them and other germs on them with your gloves. If you touch your face while wearing these same gloves, then you have likely put yourself at risk of catching COVID-19. Remember that anything you touch will dirty the outside of your gloves. COVID-19 contamination can then go from your gloves to any other surface that you touch with those same gloves. Be careful when touching items like your phone with unclean hands. Germs on your phone can spread to your face with just one phone call, you know? Or even texting on your phone with dirty hands and then putting your hands up to your face, because we all touch our face so many times. You don't even realize it. Medical providers and essential workers need to wear gloves and other PPE. So we do suggest that you don't wear gloves if it's not needed. Glove use alone can't protect you from COVID-19. And good hand hygiene can be more effective at protecting you than glove use alone. Yeah.
Well, thank you so much for your time and these tips on COVID prevention. If anybody who's watching wants a refresher on mask use and glove use, you can watch the Whitman-Walker videos on mask and glove use at bit.ly/WWH mask use and bit.ly/WWH gloves use. We have this pinned in the comments, but you can also call our team at 202-797-4439 for COVID resources. Do you have any last messages for people, Jess?
Yeah. First, thank you for having me on. I hope everybody learned a lot about mask use, glove use, and hand hygiene. Remember that mask use alone can't protect you from COVID-19. Maintain at least a 6-foot distance from others. With the exception of folks that you live with, we know that that's not possible all the time. And wash your hands frequently for 20 seconds to help keep you healthy and to help prevent the spread of COVID-19. Do wear a mask in public settings, especially with these protests. We're protesting for a really good reason, a really good purpose. But COVID-19 is out there, and we want to prevent new cases of COVID-19. These steps can help keep you healthy and prevent the spread of COVID-19. If you are either experiencing symptoms related to COVID-19 or you have no symptoms, but you've been in spaces that are hard to practice social distancing like protests, you can call our Whitman-Walker team at 202-745-7000 to schedule an appointment for COVID-19 testing at either our Northwest or Southeast health centers.
Well, thank you so much, and thank you all for tuning in. We're going to do a quick hand washing demo. We bring these back, and then we'll be out.
So you're awesome. Thank you so much for doing this with me.
Of course. Thank you for taking the time to share this information with us. It's so important.
Yeah.
Okay. I'm gonna sing the chorus to "There's Hope" by N95 It's Needed. And yeah. There's hope. There's a possibility to smile. You don't have to pay to laugh. You better thank God. There's hope. You don't have to pay to laugh. You better thank God. Every time I turn, somebody's acting crazy. That it'll drive you crazy. About my power today. Got prices, they just keep on rising. Government, they keep on lying. Gotta keep on surviving. Keep it energy. That's the truth, 'cause there's hope. That's the time. Don't pay to laugh. You better thank God. And that's like a little bit more than 20 seconds. I know everybody's tired of saying happy birthday and need some motivation to like positive choruses. India Ari, I'll that's the go-to. Thank you everybody for tuning in. Be sure to follow us on IG, Facebook, and Twitter, and at Whitman-Walker for the most up-to-date Whitman-Walker health information and content. You can also tune in to our youth team on Instagram at RealTalkDC_. And that should tune in today because at 3 o'clock we're having Floetic Uptown and I'm hosting that. And then you can also follow our cultural center where I work, and I'm also the art educator at the Corner DC. See you all soon, and thank you so much for tuning in. Stay safe and take care of each other. Bye, Jess.
Bye, everyone.